Hello, I'm John Sweetenham, the Associate Director for Clinical Affairs at UT Southwestern's Harold C. Simmons Comprehensive Cancer Center and host of the ASCO Daily News podcast. As many of you will know, 2 million people have now fled the war in Ukraine, according to the United Nations Refugee Agency, the UNHCR. Today, we'll be discussing efforts underway in neighboring Poland to provide healthcare and other support to Ukrainian refugees, particularly for patients with cancer. It's an honor to welcome Professor Piotr Rutkowski, who leads the Department of Soft Tissue and Bone Cancer at the Maria Sklodowska-Curie National Research Institute of Oncology in Warsaw, Poland. He also serves there as the Deputy Director of the institution for National Oncological Strategy and Clinical Trials. Additionally, Professor Rutkowski serves as the president-elect of the Polish Oncological Society. My guest and I have no conflicts relating to our topic today. Our full disclosures are available in the show notes, and disclosures relating to all guests on the podcast can be found on our transcripts at asco.org/podcast. Professor Rutkowski, thank you for coming on the podcast today. We're really pleased to have this opportunity to speak with you during what must be an incredibly difficult time.
Thank you for the invitation. That's true that it's a horrible time. And to be honest, we haven't expected how it can be going on. But now we have a new reality and we have to face on.
So just beginning with that new reality, my first question to you was going to be to ask you a little bit about details of the decisions made by Poland's parliament. So your parliament has adopted new legislation that provides healthcare for Ukrainian refugees and enables the creation of a call center at Poland's National Health Fund. Could you give us some more details about these new developments and how you anticipate this will help the Ukrainian refugees who are suffering, particularly those who are suffering with cancer?
Yes, that's true. Until now, we have nearly 1.5 million people from Ukraine who arrived to Poland during last 2 weeks. And because of the increasing numbers of cancer patients coming to our institute, but also all oncological centers in Poland, Polish Parliament, together with Polish National Health Fund, decided that all refugees of war from Ukraine are authorized to receive healthcare the same as citizens of Poland. This is very important because it resolves a lot of bureaucratic issues. We do not need to get a specific permission to treat the patients, and we can provide them the same care of every citizen of Poland in terms of outpatient treatment, admission to the hospitals, surgical procedures, access to the drug, prescriptions of the drug. It is absolutely important. It also means that within the frame of this new law, we can treat the patients according to all the same regulation or the same standards as Polish oncological patients. Of course, I have to stress it that Ukrainian oncological patients, except of course emergency care, have no priorities. They are going to the same, let's say, queue and the same care as Polish patients. Moreover, this is very important because for newly diagnosed oncological patients in Poland, we have a so-called oncological card, which allows for faster diagnosis, including pathological evaluation, molecular evaluation, and imaging. So they are undergoing the same diagnostic procedures as Polish patients. Of course, last week we have admitted around 100 children in need of oncological treatment to centers in Poland, but probably it was the first wave of patients. Now we have increasing number of normal adult patients with lung cancer, breast cancer, GI cancers coming to us. Some of them need also the continuation of the treatment, or they have to start specific treatment with innovative drugs. If they are reimbursed in Poland, it's also allowed to treat with all these medicines in Poland. So the second point which you asked and mentioned, that National Health Fund Polish National Health Fund established this special general official hotline for oncological patients from Ukraine. It is, and also the webpage, and this hotline is in Ukrainian, Russian, English, and Polish languages. And with use of this hotline, we try to direct the patients to the proper center, proper oncological centers, because this hotline of National Health Fund cooperates with 20 top Polish comprehensive cancer centers. Using this official hotline, it's much easier to be directed to the correct hospital treating given type of the cancer. This is very important because looking on own way can be chaotic, and it's not so efficient like contacting directly to the hotline of National Health Fund or the hotline of the oncological centers in the region where the patients are temporarily staying in Poland. So it's the best what we can recommend, and this is what have been done until now in our country.
It's incredible how quickly the Polish government has moved to help the many Ukrainian cancer patients and other patients who are coming into the country. The cancer centers in countries such as yours, who are accepting and treating these Ukrainian patients, presumably are going to struggle to have sufficient resources in terms of space, equipment, drugs, and staff to handle the large number of patients from Ukraine who will be showing up at your doors. What resources does Poland have, and what do you need from the international community to be able to help with this very large additional patient load that you'll be seeing?
Yes, thank you. This is excellent point, because now, of course, the enthusiasm dominates and normal human help. We involved everybody. So Polish oncological societies are working together, and we are providing different materials, translation for the patients. We also ask the pharma's company to provide the Ukrainian language materials which we had in the countries, and also patient advocacy groups are really helpful. And we are sending also the required medical resources to Ukraine in some official actions. However, of course, you are right that Polish oncological system had, even before this increasing number of patients, which we can calculate, means that we'll have 10% more cancer patients in this year. So it's really huge number. And until now, we had also some limitation in resources. Also, the basic drug reimbursement was on a good level when we compare to our other Central Eastern European countries. So we had relatively good system. We also started 2 years ago our new national oncological strategy. However, we also transformed to the system of three-level system of comprehensive cancer centers, of reference system, etc. So we are also at the level of some transformation in oncological system. So it's not the easiest time, especially that generally the numbers of nurses, generally healthcare providers, including different oncological specialties, is limited in Poland. And when we calculate per number of patients, it's one of the lowest in Europe. So generally, we can expect the shortage of human resources in the nearest time. Of course, we can count that we easy and temporarily facilitate qualification of Ukrainian medical staff for Poland. And this law, it's also included in this package of new laws. But on the other hand, still we're facing the problems with communication, even with medical staff. So it's not so easy. Moreover, when we calculated nowadays this number of patients will cost about 50 to 70 million euro per month additionally. So it really changes the priorities in healthcare in Poland. So I cannot tell you now, maybe we can make some resume in 2 or 3 months, but nowadays we can still resolve these issues. But what will be in 3 or 4 months, I really don't know. And how delayed can be the oncological care due to increasing number of patients. So it is what we can anticipate, and we try to reorganize at the level of different hospitals now. And we had some meetings with Ministry of Health and our National Health Fund. At the normal functioning level, still we cannot see that it's something changing, but we have first patients now, but the numbers increasing every day. So I cannot definitely say what resources, except human resources, and of course increasing funding, we need in the nearest future. We try to collaborate with different organizations. I really appreciate the meeting with ASCO and ECHO. It took place recently, and about how to transfer some patients, demanding patients, to other oncological centers. However, always it's not so easy when we again can transfer the patient somewhere else if the patient started the treatment in one or given center. So this is what we have the situation now, and what we expect that it can be more difficult in few weeks or months.
Yeah, thank you. I'd like to perhaps pick up on that last point you made about medical information on patients that you're accepting. So as a clinician yourself, how are you handling the issue of prior treatment history and medical information of patients who are coming into your system? For example, are you able to get access to their pathology reports or their imaging or their prior treatment reports? And if you don't have access to those, how are you facing the challenges of treating those patients with an incomplete medical history?
That's true. Of course, we have to translate it. We have help in our institution, but it's not a still common practice everywhere. Some of the patients have translated documents. We do not insist on the certified translations, just the original documents or copies of the documents and translation into Polish, because not all words are even well understood. The problem is that the level of healthcare in Ukraine is sometimes lower, and pathology reports are not perfect. So even if the pathological report, which we are receiving and it's available from the patient, sometimes we need to redo the biopsy and establish some molecular factors. One patient which had admitted to my department yesterday with sarcoma redo the biopsy last week because the report was not complete, and we completely changed the diagnosis in 3 days. And another patients probably will also need a rebiopsy. Sometimes we are lacking, but through imaging. Some of the patients had at least CDs with CTs or MRIs, so it's much easier. Some of the refugees had only the copy in the mobile phone, or the documents are at very different stage. If we have information how the patient was treated in Ukraine, it's perfect because they can continue the treatment. But not all kinds of treatment in Ukraine were provided according to the standards which we have in Poland. So it's also difficult because we have to rediscuss with patients how to change the treatment. So there are really individual situations. This is what can I say. And we have a lot of volunteers now helping with translation. We also employed some additional staff who is bilingual or trilingual, and it's easier. But the problems with the documentation probably will be also increasing. That's true. However, we try to simplify as much possible, and to, in some situation, redo the biopsy and reestablish the diagnosis if we haven't enough information. So it's really resolved case by case.
Yes, gosh, and it sounds as if it, certainly can add to everybody's workload and degree of stress, unfortunately, because of the additional tests that some of these patients are now having to face on top of everything else that they've already confronted over the last couple of weeks. One of the other things which I think will be of interest to our listeners in that regard is whether you're experiencing patients who are coming in who have been part of a clinical trial, and if so, whether there are any mechanisms in place for that situation of perhaps a patient on a relatively early phase clinical trial who may have received part of their initial treatment in Ukraine?
Probably it is the easiest part because for last year I have treated several Ukrainian patients in clinical trials if they hadn't the access to new drugs, and we had the possibility at least before the pandemic, because pandemic also complicated the trans-border movement of patients. But before, we had several patients in clinical trials. Many of them had also relatives and were accompanied by translators to provide the full compliance with the requirements for informed consent and, of course, the understanding all procedures. But because some companies ask us also for possibility to transfer the patients from Ukraine to Poland within the clinical trials, so they are providing us the certified translation of the documents and also the informed consent in Ukrainian. At least 2 or 3 companies, because I'm responsible for clinical trials in our institute. They contacted with us, and of course we agreed. This is much easier because it's a professional machinery, and they have at least documents, at least in the forms of CRF, so we can get the full history, how the patients was treated, and in a majority of cases also imaging. So it's much easier because everything is provided, and we also informed our bioethical committee about the situation, but it will be probably also a little more work in the few weeks.
Yes. Well, it's good to hear that those patients are able to continue their treatment on trial, thanks to all of the kind of backup support that you've been able to provide. I want to conclude by saying thank you, Professor Rutkowski, for coming onto the podcast today, and for everything that you and your colleagues and your institution and the Polish people are doing to support patients with cancer during what are obviously extremely difficult times.
Thank you very much. Cancer is the matter of all of us, and cancer does no borders, so we have to help each other in these difficult times. That's true. Thank you very much.
Thank you to our listeners for your time today. If you're enjoying the content on the ASCO Daily News podcast, please take a moment to rate and review us wherever you get your podcasts.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.